Good afternoon again. As you already know, the conventional methylene we have a very high wear rate. A lot of polyethylene particles are generated. They cause osteolysis and asexual loosening. That's one of the early failures. New trials, as you already know, using cross-linked poly and metal and ceramic. Ceramic was used since the 1970s because it has been known as a good characteristics, something like a high, biocompatible, very strong, and it has very good sliding characteristics. Also, we have very low friction and low wear. The purpose of the study was to evaluate the long-term clinical and radiographic results under 40 years of age, and out of 53 hips, less than 40 years of age, we found 5 patients died and 3 patients lost the follow-up. Among 5 patients, 3 patients were functioning very well and 2 patients revised before that. Among 43 hips we analyzed, mostly male patients, very young patients, and follow-up was 14 years. The disease was mostly avascular necrosis. And we used orthophostem, which has a very taper stem with polyporous and genofostem is macrolab, which does not have a porous coating in therapies. So evaluated clinically and radiographically, and periprosthetic membrane evaluation also, and particle analysis. I evaluated with the osteolysis as a linear osteolysis, which is linear dissecting form osteolysis, and focal osteolysis, which is expansile and erosive ballooning type. Let me show you some cases. 36-year-old male patients post-op film, in 14 years we see this is actually a xenophobe which has not have the porous coating, so it has shifted a little bit laterally, but still on the whole we see bone ingrowth, but still without sinking down even after 17 years. Another patient, 22-year-old male patients with avascular necrosis bilaterally. This is post-operative 10 years. And also this is post-operative 20 years, even though we see some radiolucent line here, but the patient does not complain, pain works well. But anyway, the patient is satisfied with 20-year results. And 39-year-old male patients, 5 years, so 19 years, we do not see any problems. However, this patient, 40-year-old male patients, at post-operative 10 years, we see here linear osteolysis, and also on the medial side, we see focal osteolysis. And 4 years later, we see a little bit more accentuation of the focal osteolysis. And this 39-year-old male patient, post-operative 6 years, we see a little bit linear osteolysis from zone 1, and we see a little bit more accentuation of linear osteolysis, 13 years. And 32-year-old male patients, post-operative 10 years, we see truncated socket loosening, which is very common finding when we use the truncated socket. And this revision post-operative 7 years. The Harris score preoperatively was 49, and at the last follow-up it was 87. And socket migration, actually the truncated socket, even though it has migrated more than 2 millimeters, is quite tolerable. They do not complain so much discomfort. And we revised about 20%. And even among the stable socket, we measured the lateral opening angle, which has actually a little bit shifted, but we saw that about 2 degrees change from 39 to 37. About the stem stability, so we do not have a porous coating and xenophostem, so we do not expect a bony ingrowth. We have a lot of failures using this stem. However, when you use the paper stem with the porous coated, we saw among almost 15-year follow-up, we saw 94% stability. Only one loosening, there's only one revision. How about the femoral slices? We saw 7 cases, linear slices in 6, and focal slices in 1 case. In the retrieval study in ceramic head, we did not see any gross constructive failure of the ceramic head. Only found some wear mark here. Here so you see the shiny portion, and this is non-shiny portion. This is actually the weight-bearing surface. This is a non-weight-bearing surface. Among the ceramic socket, the wear of the ceramic articulation, we found the maximum case was about 2 millimeters in 15 years. And we could observe several which we could not measure by just grossly. And we examined with the scanning electron microscopy. This is the shiny portion, it's a non-shiny portion of the femur head. And when we magnify this side, we can observe many wear marks which actually detach, the ceramic particles were detached from the femur head. Also, I think from the SW socket. We examined histologically of the periprosthetic membrane. We could observe many histiocytes, macrophages, or phagocytes closing the ceramic wear particles. But it was very interesting. We could not observe many giant cell reaction, which is a very common finding in polyethylene articulations. Also, in the interface membrane, when we digested with papain, we could observe very small particles were accumulated in the bottom. And this is scanning the electron microscope again, and it was roughly a globular shape, and the mean size was being about 0.75 micrometer. The largest size was about 12 micrometer. Actually, it was less. The size was less than polyethylene particles, but definitely will be bigger than metal particles. So I'd like to summarize. In non-cemented truncated ceramic socket, we had a very high incidence of proximal migration. Also, we had a very high failure rate because we do not see any bony ingrowth. Also, the femoral stem, the smooth Jennifer stem, we could observe high failure rate. But porous-coated orthodox stem, which has tapered cone with cobalt chrome alloy, we expected a good survival because it's fully porous-coated. So I think in summary, using the ceramic on ceramic, we saw very low wear, even though the wear particles were phagocytosed by macrophages, so it is definitely a stimuli for foreign body reaction. But with very low wear, the main cause of failure was poor design because we could not get the bony ingrowth of this design. But in the second generation ceramic on ceramic, we improved a lot for the design, plus low wear, so I think we can expect a longer survival for the next second ceramic on ceramic generation. Thank you for your attention.
Thank you very much. I think that